Hi, everyone. I'm Bernitha Rena with the Bernitha Rena Relates podcast. Today, I am joined by Dr. Kayla Smith. We are at the DFW Behavioral Health Conference, and she was kind enough today to stop by and just chat here today in our podcast room. So welcome, Dr. Kayla.
Hey, how are you?
So good. I'm so happy to have you here today.
We glad to be here. Thank you so much for the invite.
You're welcome. So, Dr. Kayla, are you from the DFW area?
No, I'm not. I am actually a military brat. So we traveled my entire life growing up, and then my dad retired in San Antonio.
Okay.
And I went to UNT, and that's how I ended up staying in DFW.
Awesome. Well, we're happy to have you here. I'm a native Texan, like fifth generation Texas. So
Really?
I always tell people I've been a lot of places, but no place is better than Texas.
Yeah,
so.
I hear that.
Yeah.
I hear that a lot. But I honestly would have to say the same because I'm still here. So.
Okay, there you go. There you go. Well, again, we're so happy to have you here. And so, Dr. Kayla, for the folks who are meeting you for the first time, can you tell us a little bit about your mission, what brings you here today, and what you plan to communicate?
Yeah, of course. So I'm the CEO and founder of Helen's Project, and our mission is to provide affordable and accessible mental health care, especially addressing, communities of color. Because if we were growing up, you had challenges with anxiety. You don't have that. It's okay. No, that's not what's wrong with you. Get your act together. So trying to change that narrative and saying like, hey, it's okay that maybe we have anxiety. It's okay. Maybe we have depression. It's okay that something's going on. Let's create a safe space where we are culturally responsive, we're trauma informed, where you can actually talk and there's no judgment, there's no fear, but we're creating an environment for people to share, find their own communities that are safe, that are supportive, and that are also encouraging advancement. Like we're encouraging our kiddos in our program to go to college, apply for scholarships. Like you don't want to go to college, let's go to a trade school. Let's do something that's just going to be the betterment of ourselves. If you want to be an entrepreneur, cool. Put together a business plan and let's make it happen. So that's really what our mission is. Affordable and accessible mental health care is where it really comes down to.
Very good. And so are you really, because you're very young and vibrant, and so is there a specific age bracket that you were trying to pull into your organization, or is it really just open for everyone?
It's open for everyone. I think our youngest right now is probably 6, and our oldest, I want to say, is 81, 82.
Wow.
So we literally cover the entire gambit. If you need it, we are here in one call. You can get medication, fitness, nutrition. Like I promise you, our goal is to make it easy for you to access care if you want it.
I love that. So can you tell us about how you started this mission? How did this come about? What is sort of the process, the maturation, what started you from, maybe your youth all the way to where you are today and how you find yourself working in this incredible mission?
Yeah, of course. So true story, when I was growing up, I thought I could just do whatever I wanted. And my parents said, no, that's not how this works. But then I got to college and I thought I was going to be Diamond from Players Club. I really thought.
Not Diamond.
Yeah, I really thought I was about to be Diamond from Players Club. And I got myself in a lot of trouble and a lot of really challenging circumstances. I was sold to a pimp by a person that I thought was my friend and spent several days literally tied to a bed, drugged up, and had no way out. So a person that actually was my friend and a very unsuspecting person got me out of the situation. And at that point, it was navigating life. How do I stay safe on campus when I know this man is looking for me? How do I say I had a child? How do I make a life for my child knowing that I'm always like going like this, trying to make sure no one's trying to get me? And navigating the systems in Texas was so difficult. Being blamed for my actions that took place while I was taken, being blamed for like my financial instability because I had a child, being put on a wait list because I didn't have insurance, not understanding CHIP and Medicaid, not understanding housing, not understanding any of that. Because my family didn't do that. Like we're military takes care of itself. But being by myself and trying to navigate an adult who just left this experience, it became my mission. Like I don't want anyone to ever have to do this ever again. So when I got into college my freshman year, I had a professor who said, go find a problem in the community and fix it. And I was like, I am the problem. Like, what do you mean? So I went to, don't advise this, but I followed a man in a park who was like asking me why I was crying. And he showed me the reality of homelessness in Dallas, the reality of these encampments, of these communities, how they operate, how they basically create their own network of support, and explaining to me the breakdown, how if you go to an emergency room and I give you a packet and I say follow up with these resources, I don't have a phone, I don't have a car, I can't read.
Right.
I'm not following up with anything.
Right.
So then guess what? I'm coming right back to the emergency room. So identifying those breakdowns, I was like, there has to be something in the middle. And that's where Helen's project really came to life, which is we are that middle piece to help bridge the gap in care. So through like our entire journey of this, you know, obviously I'm still in school. I'm trying to get my licenses. I'm doing all the things, but I'm seeing a constant thing happening, which is I'm giving you the housing. I'm giving you the support. I'm getting you the food stamps, and you're still losing it. But why? Because our mental health is not being addressed.
The root cause.
The root cause of it all is not being addressed. So November 2024, we sat down with our board and our team, and we were just like, what do we do best? We are amazing at providing mental health care. So we took all of our additional services and we said, we're going to put this on pause.
Okay.
Yes, we're great at housing. And, you know, they'll toot my own horn. By that point in November 2024, we had already successfully housed 673 individuals from homelessness into their own place with their name on it. And we said, we got to pause because we need to refocus, because we can get these people here, but how do we keep them there? How do we make them stay? And it was, let's find a physician that can prescribe medications for chronic reoccurring mental health challenges. Let's get group therapy. Let's get family therapy. Let's have this like awesome diaspora of different modalities, of different treatment interventions, of different people who look like the communities we serve. And let's address the root cause. Let's get you talking, because if you're a single parent and you are depressed and you have anxiety and your kids are running around and you just lost your job and you're looking at finances and you're doing all of these things, you're not thinking about that depression. You're not thinking about that anxiety. You're not thinking about like, I can't get up today and apply for another job. And then you start telling yourself you're a failure. But if I can say, hey, come talk to me every week, I got you. I got you. Then we can help that individual talk through the situation. They have some place to let it out. And guess what they do at the end of the week? They apply for the job.
Wow.
They take their kid to school.
Yeah.
They get up and they make that dinner. They say, Kayla, it's still not working. I'm still feeling anxious. Hey, that's okay. I got you. We set you up with medication management. And we don't just like play, oh, try the med.
Yeah.
No, we actually offer genetic testing. So we can look at it and say, these meds work for you, for your genotype. And like, I'm low-key a science nerd. And so like I'm over here explaining like this is the genotype and phenotype and homozygous alleles of depression. And they love it because I'm educating you. I'm not just saying, here's a pill, go feel better.
Right.
But I'm educating you and I'm teaching you to advocate. So when you meet our med management, you're like, okay, wait, I do feel better. Oh, no, that made me feel worse. And when you come and you talk to us every week, I'm like, hey, I got you. What's happening this week?
Yeah, you're empowering people to think for themselves and understand themselves. So as far as a cost, and like, what's the cost breakdown for your services?
So that's the great part of our Heal It Forward program, and that's what really makes us who we are. So our Heal It Forward program operates on a pay it forward model. I know, you know, that old movie, Pay It Forward.
Yeah.
That's exactly what we're doing here, which is the individuals who can't afford therapy. They've got private insurance or self-pay. All of the revenue that's generated there goes right into our Heal It Forward program. So if you come to me and you say, Kayla, I really need therapy, but I only have like maybe $10 a week. I say, okay, that's fine. Fill this out. And guess what? Therapy's $10.
Wow.
So that's the goal of that affordability and accessibility piece. If you come to me and you don't have a computer, okay, great. Let's go find a support network, a sponsor. Let's get you a computer. If you don't have a financial barrier, we're going to fill out this application so we can make it affordable to you.
Sure.
So that's the mission of this all, is like, if you come with a barrier, but you want the help, you want it, why should I tell you no?
Right. That's absolutely amazing. I mean, a godsend. You're changing people's lives.
Hopefully, fingers crossed,
You
right?
are. Yeah, you're changing people's lives. And this project, Helen's project.
Yes.
This organization's been going for how long?
We were a business in 2009, nonprofit in 2015.
Wow. This is absolutely incredible. And so today you're going to be doing what? You're going to be talking about Helen's project. What is your mission today?
So today I'm actually educating providers on using AI in clinical supervision. So part of like the education pathway to become a clinician is you have hours that you have to complete,
Right.
where, you know, someone supervises your hours. So I'll be talking with supervisors today about how can you incorporate AI and educate your supervisees on using AI to improve their clinical ability, improve their thinking process, improve their ability to connect with another individual, as well as the risk of utilizing AI in supervision as well.
Right, because you're essentially putting people's medical information, like HIPAA information. So are you using like GPT chat, or is there a special AI tool that's being used?
So for example, for my practice, we utilize an AI note taker through our HIPAA compliant system.
Very good.
So not ChatGPT or anything like that, but it's actually integrated where it transcribes our notes. And so it just gives like a summary of everything. So just like how me and you were talking right now, and I'm able to stay more engaged, I'm taking away that part of therapy where people like take a note and they're like this, and they're like, oh, you know, no one wants to talk to someone and be like written down, right? I want to have a conversation. I want to be engaged. So things like that make better quality care, is if I'm using tools in a responsible way to stay connected, to stay engaged, and to make sure I'm not missing something. Like a good example in the way AI has supported me in my practice is I had a whole session with a client and we were vibing. It was great. We were kikiing, we were ha-haing. And then I got to the transcription of the session and they said something and I didn't catch it. I missed it. But when I read that transcription, I was like, oh, wait a minute. And I had reception call them. I said, hey, put them back on my schedule, because like, no. So using AI as a means to like mitigate risk quickly, because I would have missed that just because I'm human. We have errors, right? But if I would have missed that, that could have been detrimental to our client. We wouldn't have known.
Right. So it's literally like a secretary sitting in the room, recording everything you're saying, typing it up, maybe even summarizing for you, creating notes, things like that. So, and it's all HIPAA compliant. So someone's not going to have to worry about, okay, is my information going to end up on the internet somewhere? It's a specific tool to help you in your clinical work.
Yes, ma'am.
That's really neat.
It auto deletes at the end. Like once it transcribes, it automatically deletes. So we don't keep any audio recordings. We have all consents prior to. So that's what I'm educating our supervisors here today, is like, how do you set yourself up, your practice up, and your supervisees up, so not only are they protecting themselves and remaining HIPAA compliant, but how are we protecting that client, and how are we using it in a responsible and effective way?
Yeah, I think this is very helpful for those out there, those viewers who maybe they're in this space that you're in and they need that help. And so this is something that they should definitely consider. And so what's the name of this specific tool? Are you able to mention that?
So we utilize Simple Practice, and another one that we've used previously is called Mentalic. Has been a really good one as well. That one actually is like for the doctors. That's how we got to this point. I was helping doctors get credentialed, and he was like, oh, I need a scribe. I'm going to use this. And it was actually a tool he was taking with him on his phone in the rooms to scribe his sessions as he was going and doing his rounds. And so I was like, can you use this for a therapist?
Yeah.
Like, if your life is easy, I want my life easy too.
Sure.
So that's kind of how the journey, and I will say, like, for me personally, in my practice, I do a lot of research and vetting before we utilize any type of tool, even any service we offer here. I'm like, no, I'm gonna try it first, because I'm not gonna just give you something and be like, oh yeah, this is fine, this is great, but I don't personally know. So it's always about like, responsibility, right? Did I actually do the work? Did I vet it? Did I check it? Did I make sure this was accurate? Did I make sure it was appropriate, and was it useful for the client and protects everyone involved?
Wow, that's really neat. So if someone's interested in learning more about what you have to offer, your Helen's project, your organization, getting involved, maybe even volunteering, how can they learn more and get more information about this incredible organization?
So our Instagram is always popping.
Okay, what's that?
Which is Helen's Project.
Okay.
And then our website definitely is where you can register, you can apply, you can meet all of our clinicians and our staff, which is helensproject.org.
That's amazing. I'm so inspired by the way that you really took what was incredible pain, it sounds like, and human mistake, right? For us to be able to say, you know what, I may have not realized the impact of my decisions, because you know what? I'll be honest with you. I was watching Players Club on repeat in the 90s, you know, on repeat. I was like, let me get me a Jamie Foxx and everything will be good.
Yes,
and so,
exactly.
And all honesty, I'm not even going to lie. I truly considered that. I was let me try to see where I can go that my parents won't find out where I'm dancing at.
Yes, ma'am.
So the only thing that saved me is that I don't have any rhythm. That's the only thing. So praise the Lord for being born in a small town. So So you really took what was pain and you turned it into a purpose to not just save your life, but help and save the lives of so many people. It's such an inspiring testimony, really, of what, what God can do in anyone's life through anyone's journey. So I'm so proud of you.
Well, thank you.
You're welcome. You're welcome. And I really appreciate you taking the time to chat with us today. We'd love to have you back and just learn more about you.
Of course, anytime.
Yeah.
Let me know. I'm ready. Let's do
Okay.
it.
I've got your information. Thank you so much again.
Thank you.